of Europe, US, Canada, and Switzerland for absolutely free. Yes! This Tabaski, enjoy our safe, fast, reliable, and convenient money transfer service with the largest payout network in the Gambia at zero transfer charges. So your family and friends wouldn't have to worry about transfer charges when sending you monies from Europe, USA, Canada, and Switzerland this Tabaski. Visit the Google Play Store or the Apple Store today. Supersonic's Money Transfer is giving you an unbeatable offer this Tabaski. Your family and friends can now send you monies from the whole of Europe, US, Canada, and Switzerland for absolutely free. Yes! This Tabaski, enjoy our safe, fast, reliable, and convenient money transfer service with the largest payout network in the Gambia at zero transfer charges. So your family and friends wouldn't have to worry about transfer charges when sending you monies from Europe. Supersonic's Money Transfer is giving you an unbeatable offer this Tabaski. Your family and friends can now send you monies from the whole of Europe, US, Canada, and Switzerland for absolutely free. Yes! This Tabaski, enjoy our safe, fast, reliable, and convenient money transfer service with the largest payout network in the Gambia at zero transfer charges. So your family and friends wouldn't have to worry about transfer charges when sending you monies from Europe, USA, Canada, and Switzerland this Tabaski. Visit the Google Play Store or the Apple Store today to download the Supersonics Money Transfer app and enjoy excellent money transfer services only with Supersonics. Support your own. Tabaski just got better with Supersonics Money Transfer.
Good afternoon, ladies and gentlemen. Once again, we'd like to welcome you to the presentation of the 105th National Situation Report on the COVID-19 pandemic in the Gambia. As the tradition allows it, it will be presented by the Director of Health Promotion and Education at Minister of Health, Mr. Morinjai, who is also the Chair of the Risk Communication and Community Engagement Subcommittee of our National Health Emergency Committee. Mr. Njai, you are welcome.
Thank you very much, Prince Abubakar Sankano, for that excellent introduction. I want to welcome colleagues from the media, colleagues and members of the National Risk Communication and Community Engagement Subcommittee of the National Health Emergency Committee on COVID-19 response in the Gambia. I'm here as the chair of the National Risk Communication and Committee Engagement, and I'm reading this statement on behalf of the Honorable Minister of Health, Honorable Ahmed Lamin Samate, highlighting on the current situation of COVID-19 response in the Gambia. And the statement reads, the 105th National Situation Report, since confirmation of the first case of the novel coronavirus disease, COVID-19, in the Gambia on the 17th of March, 2020, when the country reported the first COVID-19 case. As of today, the country recorded 1 new death, bringing to a total of 6 COVID-19 related deaths reported. This represents a crude case fatality rate of 2.8%. 2 new recoveries were also recorded. These are the case 38 and case 39 after producing 2 consecutive negative results. As of today, the country also recorded 46 new cases of COVID-19, being the highest reported in a single day, bringing to 216 total number of COVID-19 cases ever reported in the country. This is an almost 2-fold increase over the number of new cases reported in the previous day. 17 of the cases, that is 37%, 37% of the new cases are Minister of Health staff, mostly from the National Public Health Laboratory and one from the MRC Gambia. Today is a very sad day for the Minister of Health, in which we have reported this highest number of cases of COVID-19. All of them, most of them, are our own people, our heroes, our loved ones. We wish them speedy recovery. 194 new laboratory test results received, 49 from MRC, 144 from National Public Health Laboratory. A total of 219 risks and 113 low-risk contacts were traced, while 9 persons were newly taken into quarantine, 72 persons were discharged. Globally, since 31st of December 2019, as of 29 July 2020, a total of 15,641,938 cases of COVID-19, which are in accordance with the applied case definition in the affected countries, have been reported. Of these deaths, 653,649 were registered, and 9,530,110 recovered from the disease. Senegal recorded 9,255 confirmed cases, 6,170 recoveries, and 178 deaths. Currently, we have 602 people in quarantine. A total of 4,708 tests were conducted, and 216 are positive, 60 recoveries, and 6 deaths. A total of 1,182 people completed quarantine. 1,334 people were also raised. These are the contacts that are traced out of 1,384 people. A total number of 210 people completed follow-ups, which are asymptomatic with travel history to affected countries. 62% of the confirmed cases are males. Only about 35% of the confirmed cases are below age 40. 3 main waves of infection occurred: the pre-airport closure wave, the importation from Senegal wave, and the intermittent airport reopening and loosening of restrictions wave. And within the last 20 days, there has been over 60% increase in the number of COVID-19 cases reported by the country. What we are currently doing also, we are currently also doing daily coordination meetings ongoing at the strategic and technical levels. Currently also, as I mentioned earlier on, 194 new laboratories received, 49 from MRC and 144 from National Public Health Laboratory. 141 tests were negative. This includes 4 previous probable cases after they have been resampled. 47 returned positive, 46 new and 1 repeat test, and 6 become inconclusive or probable cases. On logistics, MOH received 32,280 vials of cefotaxime, 1 gram. These are the vials from the Republic of India, and this donation was facilitated by the Minister of Foreign Affairs. We thank them very much for facilitating this process. On the risk communication, 6 television and 12 radio programs were successfully conducted, 1 press briefing conducted. Influential leaders in 8 communities were engaged in radio phone-in programs across the country. Summary of social media activities include 2 Facebook and 2 Twitter posts serving a cumulative engagement of 10,788 people. The summary of calls made on 10/25, a total of 21 calls received, 19 COVID-19 are COVID-19 related, and 2 non-COVID related. 3 booked for further follow-ups by the contact tracing teams, and 7 booked for further follow-up by the quarantine team. Regarding our next steps, we want to impose stringent lockdown measures in both Western and 2 regions in order to curb the spread of the virus in this region. This is something that is already on the table for discussion. The infection prevention and control measures should be strictly adhered to in all public and private health facilities across the country. We will also continue to search for the confirmed cases who continue to be at large, and this search is being intensified. We will also ensure that healthcare workers are tested and patients at the FSTH also are tested, including the polyclinic. All health workers will also be encouraged to observe all COVID-19 preventive measures, including the donning of appropriate PPEs at all times. It has come to our attention that some family members of our healthcare workers are being discouraged not to go to work in health facilities, especially those that registered COVID-19 positive cases. We would like to appeal to the families, friends, and loved ones of our dear health workers to encourage them to report to their respective duty stations for us to support and work together in responding to the pandemic. The state is aware of its responsibility towards all public servants, especially those dealing with the day-to-day management of COVID-19 response in the country. Equally, the state takes its responsibility in protecting lives and properties of all citizens and residents of the Gambia very seriously. The various state of public emergency regulations aimed at defeating this pandemic are a clear testimony of the state's responsibility. In this regard, the Honorable Minister of Health, Honorable Hamid Lamin Samate, visited health workers that have been infected with COVID-19 and are receiving treatment in the treatment center, and as well as health workers also who are also on quarantine, to show solidarity and to give them courage in these trying moments. To all the health workers that are currently in the treatment centers, receiving treatment, as well as those in the quarantine center, the Minister of Health would like to assure you that we are together in this, and the Minister's continuous support remains available to you all at all times. All the healthcare staff, all the health staff in the treatment center appreciated the visit of the Honorable Minister, and this visit will also continue. In conclusion, we would like to remind the general public that wearing face masks helps to cut down COVID-19 transmission, and hence it is now mandatory for everyone in the country with effect this Friday, 24 July 2020. We encourage the public to use locally made face masks, which are reusable and washable. We would like the public to use appropriate and comfortable face masks, and people should not share the same masks at all times. Designers and tailors are encouraged to get appropriate specifications for face masks from the Gambia Standards Bureau, which is also free of charge. We appeal to the public to cooperate with the security personnel in this trying moment, as it is also geared towards the containment of COVID-19 in the Gambia. Finally, we encourage the public to take the offer of voluntary testing for COVID-19. Currently, the Minister of Health is working on identifying ideal locations and structures for sample collection in collaboration with the general health directors and relevant partners. It is important that the general public to continue cooperating with the authorities on matters related to COVID-19 and its associated preventive and precautionary measures. COVID-19 is real. Use and regularly wash your face masks. Together, we can significantly contain the spread of COVID-19 in the Gambia. For more information, call 1025. I thank you for your kind attention.
very much, Director Modunjai, for that elaborate and educative update. And ladies and gentlemen, as you are rightly aware, His Excellency the President of the Republic, Adama Barrow, has lifted the state of public emergency regulation across the Gambia. Thank you very much. As you are right aware, the state of public emergency regulations are lifted by the President of the Republic, His Excellency President Adama Barrow. We cannot operate in a legal vacuum, and the pandemic is still with us, and that's why the state has gazetted a new public health, in bracket, dangerous infectious diseases protections regulations. I repeat, Public Health, Dangerous Infectious Diseases Protection Regulation 2020 are now governing the COVID-19 situation in the country in the absence of state of public emergency. And what that means is a long list of regulations which we will subsequently address in a press release, where there are two declarations which I would like to read from the official gazette. And the first one is Declaration of Coronavirus, COVID-19, as a serious and imminent public health threat. And I believe you are following two words, serious, and the title of the declaration, dangerous. So it says, pursuant to Regulation 5 of the Public Health, Dangerous Infectious Diseases Protection Regulations 2020, COVID-19 is declared a serious and imminent public health threat, since A, the incidence or transmission of a COVID-19 constitutes a serious and imminent threat to public health, and B, the incidence or transmission of a COVID-19 is at such a point that the measures outlined in the Public Health Protection, in bracket, Infectious Diseases Regulations 2020, may reasonably be considered as an effective means of preventing the further transmission of the disease. This declaration is effective for 90 days. And then the second declaration, which I believe we may share with the public, is declaring an infected area, local area. Pursuant to Section 3 of the Quarantine Act, Cap 4003 of the Laws of the Gambia, 2009, the whole of the Gambia, that is the jurisdiction of the Gambia, is hereby declared to be an infected local area. And this declaration is effective for 90 days. These are two excerpts from the gazetted regulation, and then the regulations are there. It empowers the minister and the health officials and the police to actually continue to advise and take actions. So I would like to take a break here and open the floor for questions. Yeah, okay. Yeah, okay, that's it. Okay. So you do the mandate? Yeah. Okay, that's okay. You can do this. Yeah, okay. So the Director of Health will do the situation report summarize in Mandinka and Wolof, and also try to summarize the declarations too. Director, you're welcome.
Assalamu alaikum baden jiber lalu ani mun be la moy kan Gambia kono jang wala Gambia bantala to la mutana kan ko nak jade kenda bundal puka kumakandi kumakamo miyanko wala bota Honorable Minister of Health Honorable Hamid Lamin Samate o kumakamo nying komen rong be muy tan la molla wala mo ñu corona courangati corona miyanko abe keren astotale ado mobe salon ado ñin tembeng courant abo wajabe kan Gambia ado kunun kana fo bila nga min soto jam miyanko wala courant soto wala tara mo tannani ane mo woro o be kafuta wala kata mo kema fula mo tanne woro wala corona courant soto ñim banko kanjang so kamala adu mo fanan mo do fanan so fanan niwtuta corona la kuoto adu corona na dibala tande ko ala saya sunta wala o kada say mo woro wala banta wala niwtuta corona la courant so fanan be mi tandam wala ko min fon ni ko ya warande bake wala na jare kenda bunda do kulol mol mimbe na national la numbe na lab courant o di tawol kam courant keso ngin di tawol kam bake ado mo niaje mo da mimbe ko mo tanni warula min wolbe o courant keso ngin so mo kule man kan so la bake ado kule mi ko mo be ngin takram to nyama pour inshallah ko jare kenda bunda la dun tan bon ko na sain ngin tambeng mo keme woro ane mo fula wala be in tambeng quarantine wala be dal mi ko be jibe kanje adum fana mo
Supersonic's money transfer is giving you an unbeatable offer this Tobaski. Your family and friends can now send you monies from the whole of Europe, US, Canada, and Switzerland for absolutely free. Yes! This Tobaski, enjoy our safe, fast, reliable, and convenient money transfer service with the largest payout network in the Gambia at zero transfer charges. So your family and friends wouldn't have to worry about transfer charges when sending you monies from Europe, USA, Canada, and Switzerland this Tobaski. Visit the Google Play Store or the Apple Store today to download the Supersonics Money Transfer app and enjoy excellent money transfer services only with Supersonics. Support your own. Tobaski just got better with Supersonics Money Transfer.